Hi, my name is Robbie Olakh and I'm from Hamilton, Ontario. I went to the University of Waterloo and I'm currently a third-year student at St. James School of Medicine. So during my rotations, my clinical experience was quite phenomenal as it allowed me to really exercise a lot of the skills that I was taught during my preclinical rotations, such as IV draws, blood draws, and especially with the help of physicians and nurses that were there. They were very willing to really assess what the student needed and how they needed to develop, and they really catered to your needs and allowed you to grow in the clinical setting and have the best experience possible. I really enjoyed the direct relationship with the physicians and the attendings that were there. They really focused on the clinical aspect of medicine and how you should approach the different type of patients and systematically go through the history and the physical, along with assessing the initial illness correctly and determining the right assessments and showing you and kind of guiding you through the plan for the different sets of conditions and diseases that you come across. Well, I really appreciate CMTC providing me the right type of skills so that I'd be prepared for my clinical rotations, such as IV insertion, intubation, also not just that, but also the right method to certain skills, such as doing a Babinski reflex and how you could properly perform it. And having such skills really gave me a special edge when I stepped foot on the clinical field. It gave me a better understanding of how I could deliver my care and really assess a patient accordingly. The one thing that I really appreciated for the preceptors is the patience that they had for the varying type of students that were brought to them. For example, if there was a certain skill or a certain question that you're not familiar with, the physicians were more than willing to spend time with the students, really help them get over any obstacles that they were having trouble with. Well, one thing that I did find quite challenging during my clinical rotations was my time management. Now, with the help of the attendings, they were able to help better guide me. For example, they had explained to me that, well, if you have 3 patients for that day, the best way to get the studying for your material done is to study those patients thoroughly, to understand why they were there, to understand the conditions that they have, and to study based upon that. According to that, depending on how long you spend in your clinical rotations, you can pretty much cover all different subjects and topics as long as you study through your patients. One thing that I found with CMTC rotations when compared to other rotations is that with CMTC we got a lot of hands-on experience, and everyone that was there, the coordinators, the physicians, the nurses, were more than willing to help out the students in learning the right set of skills to be able to perform any hands-on assessments or examinations that needed to be done within the supervision. And that really allowed us to become comfortable with examining patients and getting that hands-on experience. The general area of the CMTC building and Jackson Park Hospital really provides a good environment for students, as University of Chicago Library is quite close, Hyde Park is only a couple of minute drive away. It's also close to several beaches and the shore, which is quite nice for students as it can allow for them to wind down before they head back to study. There are great sights to see in the area. There's definitely several restaurants and grocery stores in the area too that allow for students to be quite comfortable. I really enjoyed that with CMTC it gave us a lot of other learning opportunities such as seminars and morning report and evening report, when it really allowed us to not just focus on our patients but get a complete understanding of all patients on the floor and how patients are managed through different physicians and how residents approach patients and how they bring patients to attendings' attention and how attendings deal with patients from